Hello, I'm Krystal, and we're here on the third day of the ISPRM Vancouver Congress. And I've here with me Dr. Colleen O'Connell, who has just done an excellent keynote lecture on understanding rehabilitation in public health emergencies. Colleen, thank you for joining us today.
Thank you.
I'd like to ask you, what has been the biggest lesson for rehab in public health emergencies?
Well, I think one of the biggest lessons, I hate using the word lessons because that sort of implies that there's something that we haven't done and we need to learn from. But I think what we know what needs to be done, and we've known this for quite some time, is rehabilitation must be integrated across the entire continuum of the emergencies preparedness, our response, our resilience, as well as in incorporating mitigation strategies. Rehabilitation is a natural fit to managing emergencies. Rehabilitation evolved out of conflict. It evolved out of managing pandemic. We had polio epidemics. We were always the what next. We can't be just the what next. We have to be right there from the beginning, trying to reduce the intensity of the negative outcomes by being prepared and by building resilient communities within our rehabilitation community.
So what are your personal lived experiences, that you could tell us?
Sure. Well, the reason I even got into rehabilitation medicine was I had an opportunity to work internationally within kind of a global health context. And that's where I really started thinking, we can't be seeing the world with these geopolitical borders. We're all here on the planet together. And I just happen to be lucky to be born in North America, so I'm afforded these benefits. And, in fact, it's a bit of a privilege. I had the opportunity at a young age to be able to work in a developing country. And that's where I really fell in love with the whole aspect of what you can be as a physician. And further, for rehabilitation medicine, the approach of looking at a person as a whole. So it includes that whole biopsychosocial, what the environment is in their living context. It is so applicable to people who are living through situations of emergencies. And emergencies are not just what you think of as a sudden onset disaster like an earthquake or a cyclone. Emergencies are what people live every day as it pertains to the public health. In our own country, we have a housing crisis. Who are the most marginalized and the most vulnerable? It's persons with disability. Who are their best advocates? We as rehabilitation physicians. We have a role even at home and even locally to play in those types of emergencies. Rehabilitation is also something you can take with you anywhere you want in the world. You don't need a lot of fancy equipment. What you need is your knowledge and your skills, and you can make a difference working with individuals, building capacities and confidence so that individuals learn are able to have a fulfilling life of health and well-being. That's what it's all about, is functioning. Traditional medicine, not rehabilitation medicine, looks at survival. But what is survival without living? And that's what rehabilitation does, is living. And there's nowhere that's more intensely needed than in emergency situations.
Fantastic. Couldn't have said it better. Thank you for your insights.
Thank you.
Thank you.